Guys, Anthony here from Inner City Helping Homeless. Just a quick update in regard to where we're at in regard to our COVID-19 response. Over the last week, you've seen that as an organisation we put an extraordinary effort in place to tackle the COVID-19 pandemic that's hit the city and hit the country as a whole. Some of the efforts that have been put in place have been extended outreach supports, mobile outreach supports, our day services have been extended dramatically, additional services in regard to our European feed grant and our food cloud allocations for people that are living in poverty. Some of those programmes that are being run are being entirely run by volunteers, so those people that are putting a massive effort in to keep those programmes operational over the last couple of weeks, we can't thank you enough. Our corporate social responsibility partners have stepped up to the mark over the last number of weeks in order to ensure that we have what we need to tackle COVID-19 and to ensure that we are providing the level of service that we need to provide in order to make sure that the most vulnerable are getting what they need across the city. Some figures in terms of the outreach supports: we're dealing with on average 100 people per night on the streets. That's every night. That number hasn't reduced. It hasn't reduced over the last number of weeks. We've seen people move in and out of hostel facilities. Some people are moving back onto the streets and into tents because of the lack of physical distancing within some of the homeless service units across the city at the moment. It's against the Chief Medical Officer's advice that people that are not from the same family unit would be staying in the same facility. That's still happening within homeless services. We've seen many people come from the Irish Prison Service into homeless services over the last couple of weeks as well. We're in a position where we've also heard that this week the DOHE have claimed that the number of people that have tested positive within the homeless service system is quite low, and there's been 0 deaths within the homeless service system. Yet they haven't been able to tell us how many people have actually been tested within that same system. That to me is worrying, and we've asked for clarification on that over the last couple of days. Safety Net are doing an absolutely amazing job on the ground in regard to their approach to testing. What we need to see is a massive ramp up in the amount of tests that are being provided to people that are in homeless service facilities. Anybody that's sharing a communal living space and anybody that's sharing a facility with another individual or a family should require a test. That test should be made available to them immediately. Again, you know, we can't thank those individuals enough that are working with us, our corporate social responsibility programme partners, our volunteers that are here every day and are working from night to day to ensure that we're able to provide the level of service that we are on a continual basis, and we continue to do that right through to the end of the COVID-19 pandemic. So once again, stay safe and don't forget to wash your hands.